Hello, my name is Leonidas Hidalgo. I am going to talk about manual therapy, physical therapy, or continued care general practice for patients with neck pain. Definition: neck pain is a common problem association with great mobility and at significant cost. Always we have considered that the neck may be a source of pain from hand and that many headspace can extend upon the neck. Manual therapy is applied mainly in case of pain of vertebral origin of a not specific or not specific type mechanic and contribute unique therapeutic alternative or association with other type of pharmacological treatment or physiotherapy.
Advances in Health, I'm Rebecca Stewart. At some point in our lives, 80% of us will suffer from some sort of back pain, and that can lead to missed work, missing everyday activities, family life. But there is a new center designed just for you, specializing in care for your spine. And joining me now is Dr. Manny Sitharama, Medical Director of the Hospital of Central Connecticut's new Spine Center. Thank you so much.
Thank you for having me.
So tell us about the why. This was so important. You're already seeing people who are using this. Why?
So, like you said, one of the commonest diagnoses coming into a primary care's office, they repeat offenders, they keep coming back with back pain. It affects work, it affects recreational activities. And what is the worst thing? I have seen so many patients say, "Oh doc, I waited 3 months to see you and my back pain is better." That's why. So this is about patient access. 21st century concept for spine care.
Wow.
You can walk into our center, you can get an appointment within 24 hours. You're guaranteed to see either a physiatrist or the APRN running the show there.
So take us through, I don't think people understand, what does a physiatrist do and how does that help your spine?
That's a great question because we are non-operative management folks. This center is based on functional improvement in back pain. We want people to get better without surgery, just with physical therapy, and continue enjoying the things they want to do.
Okay.
So you're guaranteed to get a physical therapy appointment within 24 hours or even the same day. I just saw a patient the other day, had 3 trigger point injections at 10 o'clock. By 12 noon, he was in therapy.
Unbelievable. So big changes, certainly a lot of help. If you'd like more information, log on to WTNH.com/advances in health.
Application in physical therapy. Among the therapeutic strategies that physiotherapy can offer to patients with craniocervical pain and of which evidence of positive resultation has been found to date, the manual therapy intervention on cervical pain, their musculature and of pain panned out. The cervical spine therapeutic exercise focus on the same structures and device technical for the treatment or myofascial tire point as well as drive, meaning for the management of pain. Physiotherapy is in care of mobilization process of the parent to avoid the effective of the famous chronic syndrome, the pain. There is evidence that active therapy manual therapy improves proprioception, motor control, improves neuromuscular coordination and muscular strength. Endurance stabilization such as deep neck flexors, occipital, semispinous of the neck and splenium of the neck. This will mainly improve in both describing pain at rest or the active movement as well as activity of the superficial muscle in avoid in multiple symptoms such as plain neck, pain reduction to the upper limb, and even pain reduction to the lumbar region.
Let's talk about the clinical practice guideline for non-specific neck pain. Beat et al. Published a practice guideline in 2018 for non-specific neck pain. This paper guides clinicians from history taking to treatment. During the first consultations, the patient will undergo a screening procedure to assess whether physical therapy is indicated. History, symptoms, presentations, limitations, and general health are discussed. It's important to gain insight into the patient's environmental and personal factors, since these can influence chronicity. The therapist will also check for red flags. Potential red flags might be the following. Pause this video to have a more thorough look at this table. When red flags are present and inexplicable by a known pattern of neck pain, referral is recommended. The use of numeric pain rating scale and the patient-specific functional scale is advised to quantify pain and functional limitations. Your patient will want to know about the prognosis. About 50 to 95% of patients with neck pain will report neck pain 1 to 5 years later. More stats on prognosis and recovery can be found in the paper. While doing your examination, research has found that the following tests are the most valid. The upper limb tension tests for the median nerve, the Sperling test, and the traction-distraction test. Other tests are not recommended. For treatment, different modalities exist and a limit of 3 treatment sessions is advised. The following treatments have a moderate level of evidence: mobilization, manipulation, and exercise therapy. A combination is recommended. Education is not strongly supported by evidence, yet experts state it's an essential part of therapy. Treatments with a very low level of evidence are dry needling, low-level laser therapy, electrotherapy, ultrasound, traction, and a cervical collar. These do not outperform placebo treatment and are thus not recommended. Therapists should evaluate their treatment at all times and end it when the goals are met. If no progress has been made after 6 weeks, it's not useful to continue treating, since chances of achieving progress after this period are small. Thank you for watching this short video. Let me know in the comments down below what you think of these. I'm Max for PhysioTutors, and I will see you in another video. Bye.
Pros and cons. Pros. Low-cost treatment. It is not invasive treatment. It doesn't need drugs to work. Stimulation the body's activity to record the maintaining health. Improves joint mobility, creating elastic in the tissues. Cons. There is a consequent gain for the manual treatment of chronic cervical pain. In patients with little limitation, the sessions can be spread over several weeks. Make use designs and vomit in patients, joint hypermobility, uncostly fractures, joint necrosis, joint infusion air, trauma or designs, hemarthrosis, tumor pathology, acute inflammation.
Last year, over 9 million cases of neck pain were reported in the United States. A large proportion of those cases could be related to posture and musculoskeletal imbalances. For those folks, physical therapy may be the treatment as the first and best option. Our job is to assess movement, from large movements of the head and neck to small movements of the individual joints. Our PTs will evaluate your neck, your middle back and shoulders to make sure your care is as complete as it needs to be. We check strength, range of motion, flexibility. With these things, we are able to come up with an accurate PT diagnosis without the use of costly diagnostic tests such as X-rays, MRIs, or CT scans. Treatment will happen the same day. You will start your road to recovery immediately with hands-on manual care, including manipulation and manual traction. We use pain-decreasing modalities such as heat, electrical stimulation, and ultrasound. And of course, we use education to allow you to have independent management of your condition through home exercise. At Court, our goal is to improve the quality of your life. Don't let neck pain interfere with your daily activities. Visit us at court.com or call us at 1-800-645-COURT, K-O-R-T, to find a location nearest you. Call today, get moving today. Court, the best in rehab.
Plight in Ecuador. Cervical pain is a frequent pathology in Ecuador in primary health care and is attended at the first level. It may attack women, has risk factors with a sedentary lifestyle, lack of sleep, smoking, and obesity. It is inside, is high and as good as good change or worsening over time. The treatment, according to the health minister, is going to be divided into two parts. The pharmacological one is going to focus on inflammatory and rest in the physiotherapy treatment. Physical means manual therapy and exercise will be used.
I found that the type of insight that I get from Gareth and Jeff and everybody, they're caring, they want to help. There are days I've been in here when I've had nerve conductivity issues because of a pinched nerve, and they work around it. They find a way to make every visit productive for you.
Hello. If you're like many people who have suffered from low back pain and are on the medical merry-go-round trying different medications, different palliative treatments, then you're someone I want to talk to. I want to introduce a revolutionary medical approach to addressing low back pain. We get into the cause of the problem by strengthening the low back. This machine actually isolates the lumbar paraspinals while overloading these muscles here. This is a hybrid, and this is the approach that we take here at Request Physical Therapy.
I was using a walker to walk after this injury, and was actually, for the first month after the injury, I was actually not leaving my house to even come to work. Got better and better and better. When I started strengthening on this machine, I immediately felt the benefit of the strengthening of that specific spot in my back. Now that, combined with other physical therapy, simple exercises that I could do at home daily, have gotten me back to where I'm feeling just as well as I did before the injury.
Hi, I'm Joe Cerulli, and there is a good reason why Request Physical Therapy started in the first place. A number of years ago, I suffered a severe knee injury and had to have major surgery to repair the ligaments that were torn. And after surgery, I was told to go to a rehab center that was considered the best rehab center in town. As I was going through the rehab itself, I was thinking, this is so archaic, and I think I could do much better in designing a facility and caring for patients and helping people to become stronger than what was supposed to be considered the best. Fortunately, once I had that idea, we were able to get involved in a tremendous amount of medical research, working with people with back problems, neck problems, and knee problems. As a matter of fact, the machine that I'm standing by is called the MEDEX lumbar extension machine, a big part of the research that involved the University of Florida College of Medicine, the University of California at San Diego, and Syracuse University, and our centers. And through that research, I found that we had the capacity to help so many people work through their pain to get back to leading a normal, healthy, active life. And that was the impetus for the beginning of Request Physical Therapy.
They get really excited to see your gains. They get excited to see your wellness. And I've been so blessed to be able to have that in my life.
So if you're one who has suffered from low back pain, is treated by various interventions which have not worked, please give us a call at Request Physical Therapy.
Conclusion. In conclusion, the physical therapist, to obtain positive results is in the obligation to know, analyze, and employ more treatment techniques for the approach to musculoskeletal pain, special cervical pain, to active improve of the aforementioned symptoms. We will include a part of treatment with manual therapy to exercise special those low lung and high lung, flexion, extension, stabilization, exercise, gradual motor control, inner position in spine, sitting of the bipedal position. This approach will be designed to probe and integrate current movement parents that are already by stabilization with the cervical spine. Thank you.